Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, a male patient with bipolar disorder is controlled on medications. Symptoms of mania start to appear whenever he himself tapers the drugs. What type of treatment can improve the compliance of the patient? Psychoeducation is used for improving the compliance of the patient. So, psychoeducation. What is psychoeducation? Psychoeducation is a form of psychological intervention. In this psychological intervention, the patient and the family members are educated about the treatment and the disease. So, we give education to the patient and family members about the disease and also the treatment that is required for the disease. It involves discussion about the symptoms of the disease, the need for medication of the disease, as well as maintenance of regular lifestyle for the disease. So, this psychoeducation will decrease the relapses in the patient with bipolar disorder.
thank you and thank you for watching.